Assessing the eye structures and visual acuity. Procedure number 1. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, what it is necessary, and how he or she can participate. Discuss how the result will be used in planning further care or treatments. Procedure number 2. Perform hand hygiene, apply gloves, and observe other appropriate infection prevention procedures. Procedure number 3. Provide for client privacy. Procedure number 4. Inquire if the client has any history of the following: family history of diabetes, hypertension, eye disease, injury or surgery, client's last visit to a provider who specially assessed the eyes, current use of eye medication, use of contact lenses or eyeglasses, hygienic practices for corrective lenses, current symptoms of eye problems. Procedure number 5. Inspect the eyebrows for hair distribution and alignment and skin quality and movement. Procedure number 6. Inspect the eyelashes for evenness of distribution and direction of curl. Procedure number 7. Inspect the eyelids for surface characteristics. Position relation to the cornea, ability to blink, and frequency of blinking. Inspect the lower eyelids while the client's eyes are closed. Remove and discard gloves. Inspect the bulbar conjunctiva for color, texture, and the presence of lesions. Procedure number 10. Inspect the cornea for clarity and texture. Ask the client to look straight ahead, hold the pen light at an oblique angle to the eye, and move the light slowly across the cornea surface. Procedure number 11. Inspect the pupils for color, shape, and symmetry of size. Pupil charts are available in some agencies. Procedure number 12. Assess each pupil's direct and contextual reaction to light to determine the function of the third and the fourth cranial nerves.
Partially darken the room. Ask the client to look straight ahead. Using a pen light and approaching from the side, shine light on the pupil. Observe the response of the illuminated pupil. It should be constricted or direct response. Shine the light on the pupil again and observe the response of the pupil. It should also constrict.
Procedure number 13. Assess each pupil's reaction to accommodation.
Hold an object or a pen light or a pencil about 10 centimeters, that is 14 inches from the bridge of the client's nose. Ask the client to look first at the top of the object and then at a distant object behind the pen light. Alternate the gaze from the near to the far object. Observe the pupil response. Next, ask the client to look at the near object and then move the pen light or pencil towards the client's nose.
Procedure number 14. Assess peripheral vision fields to determine function of the retina and neuronal visual pathways to the brain and second cranial nerve.
Have the client sit directly facing you at a distance of 60 to 90 centimeters. Ask the client to cover the left eye with a card and look directly at your nose. Cover or close your eye directly opposite to the client's covered eye and look directly at the client's nose. Hold an object in your fingers, extend your arm. and move the object into the visual field from various points in the periphery. The object should be at an equal distance from the client and yourself. Repeat the steps for the left eye, reversing the process.
Procedure number 15. Assess 6 ocular movements to determine eye alignment and coordination.
Stand directly in front of the client and hold the pen light at a comfortable distance such as 30 centimeters in front of the client's eyes. Ask the client to hold the head in a fixed position facing you and to follow the movement of the pen light with eyes only. Move the pen light in a slow, orderly manner through the 6 cardinal fields of the gaze, that is, from the center of the eye along the lines of the narrow in and back to the center. Stop the movement of the pen light periodically so that nystagmus can be detected.
Procedure number 16. Assess for location of light reflex by shining pen light on the corneal surface. Procedure number 17. Have client fix it on a near or far object. Cover one eye and observe for movement in uncovered eye. Procedure number 18. If the client can read, assess nerve vision by providing adequate lighting and asking the client to read from a magazine or newspaper held a distance of 36 cm. If the client normally wears corrective lenses, the glasses or lenses should be worn during the test. The document must be in a language the client can read. Procedure number 19. Assess the distance vision by asking the client to wear corrective lenses unless they are used for reading only.
Take 3 readings, right eye, left eye, and both eyes. Record the readings of each eye and both eyes. As an example, the smallest line from which the person is able to read 1/2 or more of the letters. At the end of each line of the chart are standardized numbers. The top line is 20/200. The numerator, the top number, is always 20, the distance the person stands from the chart. The denominator, or the bottom number, is the distance from which the normal eye can read the chart. Therefore, a person who has 20/40 vision can see at 20 feet from the chart what a normal sighted person can see at 40 feet from the chart. Visual acuity is recorded as S-C with a correction or C-C with correction. You can also indicate how many letters were misread in the line. Example, visual acuity 2040-2C-C indicates that 2 letters were misread in the 2040 line by a client wearing corrected lenses.
Procedure number 20. If the client is unable to see even the top line of the Snellen type chart, perform selected vision test. Procedure number 21. Document findings in the client's record using printed or electronic forms or checklist supplemented by narrative notes when appropriate.